I will show you what these signs are. And I will also teach you 3 natural remedies that will help you control your blood sugar. These remedies, absolutely planners. And diabetes is a very common disease. Millions of Brazilians have diabetes, and another 40 million have pre-diabetes, and these rates are similar around the world, whole. And it is a disease that most of the time requires medication. But even though she has treatment, good news is that diabetes, both forms are correct, is a disease, it's reversible, and if the person for some reason can't stop, pause, cease, on their own, even after completely using the medication, it's still possible to reduce their use, including, I have some patients who use insulin, and after we implemented new strategies to the need for insulin use reduced significantly, even by less than half of what the person needed to use before. And look, of these 7 signs and symptoms that I'm going to tell you now, if you have any, for them, it's worth talking to your doctor and doing tests to better investigate what's happening. Agreed? And another warning, the drugs that I'm going to tell you at the end, they don't replace the treatment. Usually it's just one more for you to improve your control. It may be that with the use of these natural remedies, the need for traditional medicines is less, and then you reduce the dose. Agreed? Alright, let's go to the 7 night signs and symptoms of diabetes. The 7th symptom here is nocturnal, which is urinating several times during the night. But doctor, I get up once to pee at night. Do I have nocturia? No, just get up once, twice, it's fine. It's normal. Now if you get up 5 times, 7 times, 10 times to urinate at night, then that triggers our alarm.
Notorious, nothing.
It's more like our body trying to expel excess glucose through urine. Remember that origin of the name diabetes?
The marriage.
How does it come up?
Was
because a brave one, back in the 17th, 18th century, he tasted the patient's urine and he saw that the urine of patients with diabetes was sweet urine. And then comes the name diabetes mellitus. Mellitus from
the honey is sweet.
So our body, when it's overloaded with glucose, it eliminates this excess glucose through the urine. That's why diabetics' urine is sweet. I've never tried, and I recommend you don't try it. That warrior in the back has already played this role for us. And a big problem with the night shift is because the person having to wake up several times during the early morning to urinate, this ends up harming sleep and also ruining the next day. The person wakes up tired, without energy, wanting to sleep more. At night, several times. Very frequent urination, it indicates a maximum. The glycemic control that the person is messing up in relation to the contrary. From diabetes, the 6th symptom is blurry or blurred vision at night. And this happens because abrupt changes in glucose levels can affect vision. Bad, because it can interfere, prevent some activities, like driving. It ends up becoming kind of dangerous. So if you have blurred vision, whether at night or any time of the day, it's interesting that you see the ophthalmologist. And the good news is that this blurred vision is related to diabetes. It is quickly reversed when diabetes is caused. When there are changes in habits. So folks, diabetes treatment is like, changes in habits. 500 symptoms is excessive thirst, which technically we call polydipsia. So why does this happen? Because glucose, when it's above 200, our body, it ends up having a diuretic effect. And then during the day, the person may not feel so thirsty because the water is always at hand, always close. And she urinates and replaces it. But at night, as she continues producing urine, this person might end up getting dehydrated and waking up with a dry mouth feeling. This dry mouth can cause the person to have sores, develop mouth ulcers, increase the risk of cavities, and also bad breath. So the patient with diabetes is a patient who drink a lot of water, which is thirsty. This is also a manifestation quite found in the cases of this disease. 4th symptom are leg cramps, so intense pains in the calf or soles of the feet, especially at night, being so intense that they cause the person to wake up with these pains. And this can be a consequence of dehydration caused by high levels of glucose. So what happens when a person is dehydrated? When it ends, the blood has more difficulty circulating. That this ends up causing circulation problems. Having circulation problems it's possible that there's a decrease in the supply of oxygen and nutrient enrichment to certain locations, including your legs, your soles of your feet. And that's exactly why. Pain, because probably the blood isn't reaching the way it should in that region. And the fluctuation of blood glucose levels ends up causing alterations in potassium, sodium, calcium, and also magnesium levels, which contributes to the glucose population not having glucose in the blood. It contributes to the onset of these pains. If it's not a pain from poor circulation, if it's a pain due to lack of potassium, it could be a pain caused by peripheral neuropathy. Diabetic neuropathy, which is a disease, a problem actually, that tends to appear in more advanced stages of diabetes. It occurs when there's damage to the peripheral nerve. That's why a person has diabetic foot, for instance, because they have damage to the peripheral nerve. Ferric, she loses the tactile sensation of that limb, she hurts that limb, but she doesn't feel pain. So she keeps hurting that lobe over and over. Place that was injured until forming a bigger,
serious that ends up infecting,
necrotizing, and then you have to amputate the limb. Third symptom is nightmares. Because when glucose levels are too high, some changes are happening in brain chemistry, including causing changes in the release of neurotransmitters such as serotonin. And all this added to stress, anxiety, sleep problems from having to wake up to urinate several times, this ends up changing the person's perception. But this nightmare problem doesn't happen to everyone. And it can also indicate a number, some other problem, some other disease. The second symptom is restless leg syndrome and tingling in the legs. And it might be that the person doesn't feel any of this during day, but at night, she may have a feeling of not finding a cozy, comfortable legs, or she has that uncontrollable urge, that intense need to constantly move her legs non-stop. And this can indicate changes in blood circulation, and as we spoke, very high levels of glucose can also alter the function. So this could also be an indicator of diabetic neuropathy. Another factor that can cause this is the imbalance of iron levels and other minerals. And this problem can manifest itself in the form of numbness, in the form and also of pain. Now folks, our first nighttime symptom of diabetes is something that happens quite frequently in patients with this disease, which is sleep apnea. This happens when a person stops breathing for some seconds while it hurts. And what does that cause? What is the consequence of a person stopping to breathe for a few seconds? There's a drop in oxygen to levels that can be dangerously low. So the person, when they stop breathing, her oxygen levels drop, and we need oxygen to live. So she may have neurological damage, may have cardiovascular damage for that reason. So it's very important to pay attention to obstructive sleep apnea, especially because the person who has obstructive sleep apnea, out of sleepiness, she didn't seek to be aware of the problem, unlike the person who sleeps with her. So what's sleep snoring actually like for someone with obstructive sleep apnea? Do they snore? That's it folks, bye-bye. And then for a few seconds it will seem like she stopped breathing because she stopped snoring. And you don't hear her breathing anymore, you don't feel the person breathing, simply because she isn't breathing. So, after a few seconds, she will resume snoring. So this is very characteristic of a person with obstructive sleep apnea. She snores very loudly, and then she interrupts that snore for a few seconds, and then starts snoring very loudly again. So if your partner, male or female, experiences, so pay close attention, notify her, and advise her to seek the doctor. And in obstructive sleep opinion, one of the main characteristics is the fact that sleep is not restorative. So the person, even though theoretically she may sleep 8 hours, 9 hours, she still wakes up tired, she still wakes up hungry. While sleep apnea is not directly caused by diabetes, it is present in 50% of diabetes cases. So half of the diabetics have obstructive sleep apnea. Obstructive sleep apnea is quite related to weight, and we know that type 2 diabetics are generally a bit heavier, even because type 2 diabetes is a disease result of unhealthy lifestyle habits, mainly diet and physical activity. Folks,
this sound is serious.
And nighttime symptoms about diabetes. But as I promised at the beginning of the video, I'm going to give you 3 natural remedies to improve your control of glycemic control. So our third remedy, something we've already talked about here, is the use of organic apple cider vinegar. And the most important thing is that they be purchased. Okay, so when you go to buy apple cider vinegar, you see there on the packaging if it is filtered or not. What are you going to do? You're going to add 10 to 15 mAh, which is a spoonful of a sucker punch to carbohydrate-rich foods to reduce the peak. Glycemic after the meal.
Besides reducing the glycemic peak, what does that mean? That
If you eat a bread without the apple vinegar, it will make your blood sugar. Your sugar in your blood rise a lot. Now, if you eat this bread along with apple vinegar, your blood glucose won't rise as much. Besides that effect, apple cider vinegar also helps lose weight, improves metabolism, can help control cholesterol levels, and so on. It creates satiety. How are you going to take the apple vinegar? You will and dilute a tablespoon in a glass of water. One, it says, one of the best times to take it, fasting, before lunch and before dinner. And look, important notice here, don't drink as pure apple cider, and be careful not to brush your teeth. It's good after you have apple cider vinegar, if you have with the cup, that you do a mouthwash so that the acidity doubts. Do not harm Ismael, which is a fruit with medicinal properties already recognized for thousands of years. So it's very interesting that you should take 200 to 250 milliliters of chili pepper juice, pomegranate juice, every day for 3 to 4 weeks. But I know it's hard to find pomegranate juice. So if you have it 2-3 times a week, it already has a low effect. Interesting. And then to make the juice, you can blend the seeds with water in the blender and drink without straining, right? Drink that liquid or consume the seeds directly, which I think is even better. So you can consume about half a pomegranate or a pomegranate to better control your glucose, your blood sugar. Depending on the size of the pomegranate, it'll be a whole or half a pomegranate. Lastly, our first natural remedy. It's beet juice to take every day, and the effects of beet juice are even better when they are combined with physical activity. So O, which is the perfect combo to control blood sugar, beetroot juice, and walking. This will improve your circulation, will lower your blood pressure.
What is it going
more
to do?
blood, more oxygen reaches your muscles. So beetroot with walking, with physical activity, is a combination unbeatable. Folks, as I said, control of diabetes.
It's necessary.
Changes in Zara. Do you know what you need to do to change your habits and start controlling your diabetes without medication? Click now on the first link in the description and get your longevity code. Because if you read the book and put what's in practice there, your diabetes will improve. I guarantee you. Because it's not me who's taking these ideas out of my head. No. It's based on scientific studies, on hundreds of scientific studies that I read to write the book. So look, if you do here, your control of diabetes, your quality of life, your energy, your blood pressure, your cholesterol will increase. I'm absolutely sure it will improve. So hey, click on the first link in the description and get your longevity code now for only $25.90. If you don't register, we have unconditional satisfaction guarantee. Didn't like the book, read the book, found it useless for you, just send an email and we'll refund you. Questions without bureaucracy. Agreed. So hey, click there on the first link in the description and get your longevity code. Folks, I'll leave it there, huh? A big kiss for you. Thank you very much for your attention, and I will be back. If not later today, I will be back tomorrow with surely in the morning. Okay? A kiss everyone. Love you, great day. Let's go for this blessed Wednesday. We're together.